All right, we're recording. Anyway, hopefully I have this little bar that I've been checking. Oof. Um, so
Uh-oh,
anyway,
it's starting.
it is starting.
Yeah.
Mm.
Hopefully it was just that.
It was good
Ay,
until you said that.
It was good until
yeah,
you brought it up, right?
I shouldn't have said anything. Um, okay, well, I will keep problem solving. So anyway, today, we'll start out by doing the quiz, and then we'll um, review the quiz and do a whole bunch of teaching with the quiz concepts, and then we'll review content for weeks 1 and 2. Okay, and if we have time to do the Cahoots activity, we will. Otherwise, you have it, and you can do the Cahoots activity for weeks 1 and 2 on your own. Okay.
Oh yeah, I thought that was prep for the quiz. I did it a few times. I didn't
Oh,
know what.
good.
Okay.
Yeah. Yeah. That's great. That's great. So you all have your quiz. It opened up about 5 minutes ago. It's quiz 1. It is a KGA, and so you have to be proctored. So everybody has to stay on camera for this. Please hit submit when you're done. And when everybody's done, I have a couple of students that have accommodations, so they have a little bit of extra time. If you're done early, don't log off. Okay, stay on. Because the attendance record will pull up that you logged off and logged back on, and all that gets tracked. There is an access code for the quiz, and it's my last name. I'm going to put it in the chat here. Let's see, everyone. Oh, no, I just put it, hang on, everyone. All right, so I just put spelled the Marvel. So go ahead and get started on the quiz. I'm going to make sure everybody's muted.
What time do we come back?
Well, it's 4:06, so there's a time on it. 15 minutes, so whenever you're done. So let's say 4:25.
Okay.
That work?
Yep.
All right. So go ahead and get started, and I'm going to mute myself. I don't need to know when you're done. Just I can check that. So go ahead and get started. Okay. If anybody has any questions while we're all muted, just put it in the chat. Is everybody done? Anybody still working?
I don't know how to sit. I don't know how to sit on the camera and talk. I said I'm texting the answer.
You don't know how to what?
Not you, Miss Marvel.
Oh, I don't know if you're talking to me. I don't know.
I'm sorry. I thought we were on a 20 a break till 4:26. Don't even know. No, I was trying to answer a question. People are still taking the test. It was eggs.
Okay, maybe 2 or 3 more minutes and then we'll go ahead and review the quiz. Okay, everybody done? How'd you do? I have no's, I have yeses.
Great.
I mean, I
Okay.
think I missed the one that was select all apply. I guess I didn't read all the questions, so I only picked the veteran because I didn't know it was select all apply.
Oh, it says select all apply in the question, right?
Mm-hmm.
Yeah,
I guess
Yeah.
that's like, go ahead.
I didn't. Oh, sorry.
no,
Good.
go ahead.
I didn't do the best, but I didn't do as bad. I mean, I don't know.
Yeah, I thought there were some tricky questions, honestly.
Yeah, this class is like set up different, like a different way of thinking than I'm used to thinking for like exams and quizzes.
In what way?
So yeah, so it's like I have to train my brain, you know? So
Okay.
this is my first like insight, I guess.
Okay,
I did pretty good. It wasn't that bad. I got like you said, I don't test good on select all that apply, but
Okay.
overall I did pretty good.
okay. What else?
I think there's two things that I definitely need clarification on. It's the difference between community nursing and community-based nursing, like examples. And
Okay.
then the other thing is just like kind of more examples on the difference between secondary and tertiary prevention.
Yep,
Totally
primary,
agree.
secondary, and tertiary, and we will go over that when we cover the quiz. Okay, and those, okay,
Hmm.
did everybody do their readings and kind of prep work for the last couple of weeks? Okay.
Yes, that's what I'm.
I did
I mean, I didn't do
everything.
bad. I got that 8, and then it's like a 3-3. So
If
I
you
mean,
got an 8, you're doing good.
I missed that first question, and I was
Okay.
like, I think I went back and I switched it around because I think I had the
I
preventive.
did the same.
Marquis,
Yep.
don't you guys be changing your answers.
Mm.
Otherwise you
I,
get,
I didn't do as good, but I'll do better next time.
okay. I've got some background noise with somebody I'm not sure with, sounds like kids. If you guys could mute yourself, that'd be fantastic. All right, let's go through the quiz. I'm going to share my screen. First, I need to figure out, 1 second. Is everybody back? Jordan, I don't see you. Where's Jordan? I see your chair, but no Jordan. Rebecca, I don't see you.
I'm sorry, my kid was opening the front door.
Oh, no worries. I think I can see everybody else. Okay, there's Jordan. All right, let me share my screen. Oops. Second. Everybody see my screen? Yes?
Yes.
Okay. So this first question is the difference, I think it between community-based and community-oriented nursing. Okay, so here's the way I remember it. Community-oriented nursing is you're orienting yourself to the whole community. You're looking at the whole population. Okay, it's population focused. Okay,
So is it
it's about health promotion, health maintenance, recognition. Community-oriented nursing is also synonymous with public health nursing, where you're looking at the whole community. Okay?
So the first one would be the first one would be an example of community nursing, right?
Community-oriented nursing.
Okay.
Let me finish my explanation, Ryan.
All right. sorry.
Community-based nursing, I think about it, you're based in the community. You're working with individuals, you're working with families. So that would be a school nurse, a hospice nurse, a faith-based nurse, an occupational nurse, a public health nurse, a home health nurse. You are based in the community. Okay, so it's individuals as opposed to the whole community. Okay, so the correct answer would be B, correct? Why
Yes.
would B be correct?
Because you're
Because
educating your
Community.
teachers and
It's a
child.
like community thing, like a prevent. It's a program. A
You're-
prevent. I mean, the school teacher.
Right,
And
you're the school nurse.
Mhm.
B means
You are
you're the school.
teaching.
Right, B means you're the school nurse. You are in the community, working in a community setting. So in this scenario, you're in the schools. Okay? A, developing a teen pregnancy program is for the whole community. So that's community oriented, right? C, same thing, evaluating the outcomes of a community vaccination program. They are looking at it from a community standpoint.
Professor,
Yes, Ryan?
I'm sorry to keep asking questions. Would that also be an example of public health?
Yeah, that's what I just said.
Okay.
Community-oriented nursing is synonymous with public health nursing. Public health nursing looks at the whole community. Okay, it
Oh,
looks at
okay.
Public health nursing looks at the needs of the community.
Okay.
Okay, where if you're community-based, you're based in the community, working with individuals, families, kids in schools, people in hospice, the elderly, right?
That makes sense.
Children, okay?
Thank
Does that
you.
make sense? So that's the overview of community versus community-oriented versus community-based. Okay? Okay, this question required you to go into the Healthy People 2030 website and peruse the website and understand what Healthy People 2030 is all about. Okay, so what's the correct answer here?
The first one.
The first one.
The first one, right? Healthy People 2030 is a national campaign that provides a framework to improve the health of all Americans, not a specific group, everybody. Did you guys have the chance to go on the website?
Yeah.
It's a very impressive website, is it not? Healthy People 2030 started out as it started out in the 90s as Healthy People 2000. Then they went to Healthy People 2010, then went to 2020. Now we're in 2030. So it's looking at for a whole decade, right? So it's a national campaign to improve the health of all Americans. It's actually an excellent website. I would spend some time on it. Okay, so what it isn't is it's not guidelines for treating the most common chronic diseases. It has nothing to do with nursing curriculum. Okay, and it has nothing to do with focusing on community health to individual health. It looks at the framework to improve the healthcare for all Americans. Okay?
Okay.
Question 3. Which is true regarding uninsured versus underinsured individuals? Let's just think about this question for a moment. Let's say you've done no reading, no preparation. Think of what it means to be if you're uninsured or underinsured.
It's 3. It's the one that they'd be less, they'd be more likely to be diagnosed with advanced diseases. Because if you don't think you have insurance and you worrying about the cost, you're not going to want to run up any bills.
That's what I said.
You're gonna
Yeah.
get treated. I mean, just off of just a regular mental
Right.
thing. Like,
Well, think about access. Think about the issues. Think about the issues of the uninsured and the underinsured, right? They're much more at risk, right? They're at risk for not having access. They're at risk for not having quality care. They are much more likely to be diagnosed in the advanced stages because, like Marquita just said, they're not going to focus on their primary care, right? If they're underinsured or uninsured. Okay, so by the time we see these people, they're typically well down the road with advanced diseases or advanced diagnoses or advanced conditions. Okay, A is just the opposite, right? They're less likely to attend preventative wellness visits. Does somebody need to mute their background, please? Please. Thanks. Okay, hang on, let me stop sharing here and see who I need to mute. Who needs to mute? Way too much background noise. Sorry for the interruption. Okay. looks like-
Professor,
Yes, Ryan.
sorry, I want to just let you know there is a lag right now that some of us are experiencing.
Okay. I'm sorry
Just
about
if our
that.
No,
Yep,
it's fine. I just want
I'm
to, if the
working on it.
communication between us is a little bit slow, where some of us are just, it's taking a little longer to hear what you're saying.
Okay, I appreciate that feedback.
Mm.
I'll continue to work on it. I appreciate it. Okay, so A is the opposite. They're less likely to attend preventative wellness visits. Right? B is the opposite. They're more likely to develop preventative illnesses because they're not seeking preventative care. Right? And they're more likely to need government health resources. Okay, does anybody have any questions about that? Okay, question 4. This comes from your Canvas reading of Introduction to Vulnerability. All right, so this is the select all, the reply. Marquita, I don't know if this is the question you're talking about. Which of these groups belong or are considered part of a vulnerable population?
Would it be the veteran, the substance abuser, and the HIV?
Correct. Correct. So B, C, and D. Why is
I don't
A
know
not?
why. I picked pregnant too. I don't know why. I was thinking, oh, they're vulnerable, but I guess not really in regards to like the same vulnerability.
The
Well,
pregnancy is because the
No, they are.
Yeah, the
They're
age of
vulnerable.
pregnant.
it's because it's not a teen.
exactly.
Teen is an adult.
Exactly. It's
I
the
got a little bit
age.
happy. Okay, yeah, that makes sense.
Does that make sense?
Yeah.
And then the STD, I mean, it's an issue, but it's not considered a vulnerable
Vulnerable.
population as a whole.
Wait, I'm sorry. Can you please explain that again, please? I'm sorry.
Which part? The pregnant women? Vinia,
Like,
which
why
part?
is pregnant? Yeah, like why
Because
is
of the
pregnant women
age.
not?
We consider teen
Okay.
pregnancy a vulnerable population. Okay, this is a 26-year-old. We don't consider yes, there are pregnancies that are vulnerable, right? At any age, but we don't consider every pregnancy vulnerable. We do consider teen pregnancy a vulnerable population.
So you didn't pick the last one because it's not like you can get rid of it, basically?
Yeah,
Or
it's just not overall considered a full vulnerable population. Yes, it exists. You know, it's like people with hepatitis. It exists, but it's not considered a vulnerable population. Okay?
okay.
As a whole.
That's not considered a vulnerable population, the last one, because it's not considered a STI, right? Because
Correct.
if it was a STI, it would have been it, right?
Well, no, not all STIs are considered vulnerable populations. Think about people as a whole, veterans as a whole. Okay? Teen pregnants as a whole. Okay?
Yes, Marvel.
Yes, Kara.
So for what did you just say about
Okay, so the HIV, so if it's like, she was asking about the STIs, if it makes you vulnerable, would it just be if it like suppresses your immune system, that's what makes it vulnerable? Like
Well,
HIV would
and all the
suppress-
other factors that go along with HIV in general to make them perceived as a vulnerable population. Yes. Yes.
Okay, thank you.
You're welcome. Okay, question 5. Okay, before we answer this, what does resiliency mean?
Like bouncing back from something.
Yeah.
Despite I guess you could say despite having compromised like what do I want to say?
Ryan, I'm going to put you on hold for 1 second. I want to take this phone call. It's from this IT person I've been working with real quick. Hang on.
It will give you a chance to come up with your wording.
I have my answer formulated.
Compromised situation, immune system, whatever it may
It takes me a minute.
be. I know. God bless you.
Can we just call it a day? Everybody good?
Only that one.
Okay, sorry about that, you guys. Trying to work on it. Okay. Where were we? Whoops. All right. Everybody see my screen? Yes?
You had a students.
Yes.
I
Pardon me?
offered everybody, I said, you got a good group of students. I said, everybody can be done. They said,
Everybody
Nope.
what?
I said, you have a good group of students.
I know.
I offered everybody to be done and everybody stuck around.
Oh, well, yeah, I just said I was going off briefly to talk to this IT guy to see if he could log in and help me understand what's going on, but he couldn't. So I hope everybody stayed. I guess I need to check that. Did everybody stay?
You're
looks
fine.
like
We
it.
all stayed.
He was trying to
Oh.
be funny.
Oh,
Yes.
oh, you're trying to be
Yeah.
funny. Oh,
Yeah.
okay. Well, thanks, guys. I'm working on it. I'm working on it. All right, let's go back to the quiz. All right, what does the word resiliency mean?
Move
I was
on.
just gonna say, yeah, your ability to overcome adversity.
Okay.
In particular, like people who are able to like mitigate and manage and overcome things despite being like a vulnerable population.
Okay. Yeah. Well, and that's exactly why we're bringing it up, because so much resiliency look at the question. How does resiliency affect vulnerability? Well, think about it. Your vulnerable populations probably don't have a lot of resiliency. Part of our role as nurses is we want to help them develop resiliency or increase their resiliency or get back to their resiliency, right? Vulnerable populations have lots of risks. Okay, so resiliency is a big part of our work with vulnerable populations. Okay, so the more resilient you are, it's going to reduce your vulnerability to certain risks, which is answer A.
A.
Right? Having resiliency reduces your vulnerability to certain risks. That's the goal. Right?
Yes.
If you look at B, resiliency decreases the likelihood that you're going to get sick. All right, because of your resiliency. So it's the opposite. C, resiliency does not depend solely on genetic predisposition. It doesn't. That's part of it, can be part of it, but there's a lot of other factors. And then D is just flat out wrong. Resiliency cannot be learned if you don't possess it. That's absolutely not true. It absolutely can be learned and practiced. Okay. Okay, number 6. Okay, so this is what we call a priority question. When you think of your ABCs, okay, this is a school nurse question. And before we answer it, it's not that every one of these students will get seen eventually, right? But this question is asking who are you going to see first?
The one that's coughing.
The one that is a
Any
coughing.
type of obstruction of airway. That's
Yeah,
Right.
ABCs, like you said.
Right. The 9-year-old complaining of cough and unable to participate in physical exercise. What are those potential signs and symptoms of?
Asthma.
Asthma. An asthma exacerbation. Okay, so that's your ABC question. All right, so yes, the other 3 will get seen, but the question was asking you to prioritize who's the most important to see. Okay, this question comes from your reading about iron deficiency anemia. What do you recommend? What food do you
Eggs.
recommend?
Eggs.
Eggs.
Protein.
Yes, exactly. Exactly.
Professor,
Yes,
I'm
Ryan.
sorry, my thing just cut out during question 6. Can you just explain, the rationale again for the answer?
6?
Yeah. It was which, child should the, school nurse care for first?
Right, so, okay, what
Okay,
did you
so
choose, Ryan?
Well, I initially thought, oh, like airway, breathing, circulation. I thought it should be the 9-year-old complaining of cough.
Yes,
But then I changed my answer to the 7-year-old complaining of itching with a rash and excoriation on all 4 extremities.
so you had your first answer was correct, because this is a priority question. It's asking, who do you want to care for first? So you need to think about your ABCs,
Right.
right?
Okay.
And so
Okay,
that's
yep.
that 9-year-old is presenting with symptoms of an impending asthma attack,
Okay.
right?
Yeah. Yeah. No, absolutely.
Okay,
That makes sense.
don't change your answers, Ryan.
All right.
Okay, school nurse notes a dark discoloration along the neck crease in the armpits of a child. Which, okay, who do we need to mute? Somebody need, if you got, okay, let me go through and see who needs to mute to get rid of that background noise. Sorry, I don't know who iPhone is. Who is iPhone? Somebody is signed in with iPhone. If you could, whoever signed in with iPhone, if you could put your full name in as your Zoom ID so that you can be identified in the attendance, that'd be great. Thank you. Okay, so the nurses notes a dark discoloration along the neck crease in the armpits of the child. Think about pediatrics. Okay, which step should the nurse take?
Advise
No,
parents
as a
to
parent
to
obtain a full medical evaluation.
medical evaluation.
Medical evaluation. What is this? A
It might
potential
be diabetes or
Diabetes.
Exactly.
Yeah.
Good.
Mhm.
Good. Yep, this is a potential sign of childhood diabetes, right?
Yeah.
So that's the most important thing, to advise the parents to obtain a full medical evaluation. Okay, question 9. Which nursing intervention is a priority for a child experiencing developmental delay? First of all, before we answer this question, what is the important word in this question?
Priority.
Priority.
Priority, right? So let me give you a little bit of my 2 cents with exam taking with regards to this question. I don't know. I know that ExamSoft has the one of the things you can do is use a highlighter. Okay, I don't know if anybody knows about that. Hopefully you do. And if you use it, my suggestion would be that you use the highlighter function in ExamSoft, and as you read through each question the first time around, you highlight any word, cue, or phrase that will help you direct you to the right answer. So a word like priority would be something you would highlight. And that's my suggestion for tackling all your questions, whether it be quizzes or especially exams. Okay, use your highlighter as you're going through the question, highlight anything that seems important, words, phrases, cues, and then also use the underliner for your answers. The first time you read through your answers, cross out what you know is not a correct answer. All right, so that's your first go around with your questions. Highlight anything in the question and then underscore or cross through any answers that don't seem correct. Then when you go back, because I'm assuming everybody's reading a question twice, then when you go back to read it a second time, you will have anything you highlighted in the question, and then you may only have 2 answers to choose from. Okay, so this is a good example of a question like that. right? Now, which nursing intervention is a priority? So you'd highlight priority. For a child experiencing developmental delay. What was our reading about this week? Some of our reading. What is this a potential
Lead
sign of?
exposure.
Lead exposure. Okay, it's not that determining a family history of developmental delay is not important, and it may be important once we identify what the problem is, but it's not the priority. Does that make sense? So you
Yeah, I feel
have
like
to
it's
have,
always, like rule out physiological reasons before mental. That's usually what we learn, but I'm not sure if that applies here.
say that again.
I like to like rule out like a physiological reason of why it would happen, like a physical reason rather than like a mental. That's what we learn. But I don't know.
Well, the readings, part of the readings this week were about potential lead exposure.
Right.
And
So that would be physically like ingesting
Yeah.
it or being around it. That's
yes,
why. Yeah.
yes.
Professor, one more question. It's about question 8. So my only I understand why I was unaware that's a sign of diabetes, an early sign of diabetes, but my only thought would be, as a nurse, don't we want to finish like our like kind of head to toe assessment? Because it's asking what would the nurse do next. So if we see something on the patient's body, we're going to further examine the body to see if it's anywhere else, right?
Not necessarily. Not necessarily. I mean,
Okay.
you're looking at what they're presenting with. Okay,
Right.
discoloration in the neck. We know that the discoloration in the neck is a common sign of diabetes. So before we would go and do a full head to toe assessment, we wouldn't be doing that. We would be asking the parent to take the child to their own doctor to do that. We wouldn't be doing that.
Okay. The only reason I said
Basically
next
going
was
to like a
because
focus
you could
assessment
also
after you
assume,
do that.
not assume, but like there's a number. I didn't know that correlate with diabetes, but I would also think, okay, is this kid getting abused at home? Is he getting bullied in class? Like there's other things that a child, a
Right.
school age child
Right.
might have, like dark discoloration.
Well, okay. But
That's the only reason I would
none
look
of
at his
that
whole body.
okay, let me just do another teaching moment about exams. All the things that you're bringing up, Ryan, they're not in the question.
Okay.
Okay, you're overthinking this question.
Okay.
Okay, so if the information is not in the question, it doesn't exist.
Okay.
So you're thinking, well, what if the child's abused? Well, what if no? That where it's just simply stating, here's what the child is presenting with. What should we suggest? If a
Okay.
child was presenting in the clinic to me with that, that would be an immediate call to the parent to get a medical evaluation. I'm not
Okay.
thinking abuse. I'm not thinking, what they had for breakfast. I'm focusing on exactly what's in the question.
Okay.
Does that make sense? So
Yes, absolutely.
don't add information in that's not there, because
Okay.
you could do the what ifs forever, right?
Yeah, absolutely.
Okay, so last question. The nurse notes that the child's BMI is in the 90th percentile. What is that a sign of?
Obesity.
Obesity.
Yep.
Okay, so obviously we wouldn't do A, advise more frequent snacking. There's no need for an urgent medical evaluation. You make the assumption that the parent's already working with the doctor. They know the student's obese. And we certainly wouldn't do D, recommend 100% fruit juice between meals. That's all sugar, right? So by process of elimination, we would encourage parents to reduce overall screen time. That's what I would do with a parent. If I did my screenings at school and found a group of students that are at risk or maybe already obese, and I speak with the parents, this would be something I would make sense to recommend.
Yeah. That's the one question I had to read like 4 times because I went to pick, juice. I'm like, oh yeah, juice is good. And then I had to kind of like look back at it
Oh, yeah,
again.
yeah, yeah. Not that kind of juice. Not that kind of juice. Okay, so I'm going to pull out, let's cover some content that we haven't covered. Okay, so this is your PowerPoint for week 1. Okay, here's what we covered. We covered Introduction to Community Nursing, which is basically you need to know the difference between community-oriented nursing and community-based nursing. Okay, and here's where I stated oriented is around the community of the population. Based is in the community. And then public health, as we talked about, is a specialty area of community-oriented nursing, often used interchangeably. Let's spend some time on levels of prevention. Okay, this is the way I remember it. P for primary is prevention. S for secondary is screening. T for tertiary is treatment. So primary prevention, we are trying to prevent a problem before it even occurs. We're trying to prevent an illness. We're trying to prevent a diagnosis. With the school kids, we're trying to prevent maybe an injury. So maybe we're teaching about younger kids, we're teaching about helmet safety, riding bikes. Maybe with adolescents, we're teaching about seatbelt safety with getting your license. Maybe we're working with high schoolers or middle schoolers talking about safe sex, talking about the risks of substance abuse, the risks of using drugs. You're trying to prevent something before it happens. Maybe we're working with parents that that have chose not to get immunized, but we're educating the parents on the importance of immunizations to prevent childhood illnesses. Okay. Secondary is screening. I also refer to secondary as early identification and early intervention. So what you do is you're screening for risk. So that's why we do screening mammographies, screening colonoscopies. Maybe health fairs do screening for blood pressure, screening for blood glucose. We're trying to identify risk. So in the schools, I'm trying to identify kids that may be at risk for obesity, kids that may be at risk for behavioral issues, kids that may be at risk for suicide, kids that may be at risk for substance abuse, alcoholism. Okay, everything about secondary is screening, identifying risk. Because once you identify risk, you can attempt to try and reverse course. So let's say I screened high schoolers and I found a group that is at risk for obesity. They're not obese yet, but they're at risk for it. Maybe they're a little bit overweight. Maybe they have there's a lot of obese people in their family. Maybe they have predisposed to obesity. Who knows? So I'm going to work with them to try and reduce that risk. Does that make sense? Maybe if they're at risk for substance abuse or suicide ideations, maybe I'm going to refer them to the social worker or the psychologist, right? You've early identified, you're trying early interventions to prevent it from getting to tertiary. Make sense? Where tertiary, the key with tertiary is you have to have something. You have to have a disease. You have to have a diagnosis. You have had an injury. Maybe you've had a stroke. Maybe you've had a heart attack. Maybe you're in rehab for substance abuse. Maybe you're in detox for alcoholism. Okay, so tertiary, we're trying to manage what's in front of us, whatever that is. A TBI from a bike injury. You know, a TBI from a car accident in the school setting. We're trying to help reduce the symptoms to improve the quality of life to the best that we can. So maybe somebody with hypertension, we're helping educate them on a low sodium diet. Okay? Maybe somebody who's obese, We're working with them to try and get them into a weight loss program. Okay? So tertiary, you have to have something. Does that make sense? The one thing I want to be clear on is education. A lot of times students get tripped up in the primary, at the primary level is the only level we do education. They think prevention, okay, if we're going to try and help prevent something, we're going to be educating. Don't get tripped up because education is at every level. Think about it. In the primary, we're educating to prevent, right? Secondary, we've identified risk. So we're educating on how to reduce that risk. Make sense?
So, yeah, so like for primary, it'd be like normal kids of a normal of a BMI, how to continue that way. Secondary is a child who's or anybody is at a higher risk of a BMI, so we're going to educate them to
reduce
make
their
better
risk.
choices.
Exactly.
Okay.
Right. And then tertiary, Taylor,
maybe diabetes or something from
you're
the
teaching,
vet or-
yeah, you're teaching them how to manage their blood sugar. You're teaching them how to take their medication. So my point is education is at every level.
Okay.
All right.
That's
Don't
helpful.
just, okay. Don't just think of education at the primary level. Okay. Okay. Healthy people 2030. I want you to review slide 6. I'm not going to read it, but there are 5 overarching goals of Healthy People 2030. Here they are. And if you read this slide, you would understand, you got the quiz question right, which is you can see that all these overarching goals are focused on the whole population. Right? If you look at here, improve the health and well-being of all. Potential for health and well-being of all across all the life stages. Health and well-being for all. Okay? Okay, vulnerable populations. This was in your Canvas reading. Okay? We know every single zip code that we all live in has numerous vulnerable populations. Okay? Some geographical areas have more vulnerable populations. Some geographical areas maybe have more poverty, right? They have more crowded living conditions. Okay, they have more violence in their communities based on geographical location. Okay, we know that children as a group are vulnerable, elderly, vulnerable, chronically ill, vulnerable. Non-English speaking people are vulnerable. Okay, why are kids vulnerable? I'm just looking at my own notes here. Why are kids vulnerable?
Because usually they don't know no better, right? Like they don't.
They cannot
they
defend
can't really.
themselves.
They
Who's going to
can't- yeah.
advocate? Who's going to advocate for them?
The
Yeah, they
parents
can
have
only
to advocate. They
themselves.
can advocate for themselves.
Right. Why are
Mhm.
senior citizens, why is the elderly vulnerable?
Um,
Because they can't always express themselves.
Exactly.
Maybe they're like healthcare, like the person that takes care of them, like isn't willing to take them to their appointments or just think they're overreacting or something.
Absolutely. And elderly, like children, are very at risk for neglect and abuse. They can't advocate. A lot of them can't advocate for themselves as well.
Jeremiah, bring my grapes.
Pardon me?
Sorry.
Oh, that's okay. Right? So there's a lot of similarities of why they're vulnerable. What about the chronically ill? Why are they vulnerable?
because they're ill.
And think of the long-term implications
Yeah.
of being chronically ill.
Mhm.
most of our healthcare in this country goes to chronically ill patients, whether they're in an acute care setting or in the home. Right? These are sick people that consume a lot of resources, right?
Yeah.
What about the non-English speakers? Why are they vulnerable?
Because their language, the barrier. They cannot
Because what?
communicate what they need.
Right?
The language barrier plays a major part, but also some of them are here without papers. So it's very hard for them to get in and to get some appointments. I work in a clinic like that. We get a lot of them that come in and they're
Absolutely.
scared to come in because they're not legal.
That is exactly right. Christina, bingo, good job. So that's one of the big reasons, could be immigration status. Another big reason is they simply can't speak the language. So they can't speak the language, they can't understand the language. So if they come in, how are they supposed to communicate what's going on? How are they supposed to understand the discharge instructions? How are they supposed to understand what they've been diagnosed with or what the discharge papers say? Right? And the other thing to be, and Christina, you can probably speak to this, is sometimes we always think of, oh, great, they have a family member who speaks English. I did this in the schools with the kids. The sibling would speak for the parents.
Right.
Yeah.
But how do you understand? One of the things we'll talk about as we get into this class is literacy, health literacy. One of the biggest problems with vulnerable populations, especially the non-English speaking, is literacy. Do they even understand what you're talking about? And then how do we, yeah, it's great to have family there and they may speak better English than the client, but how do we know how much they understand?
Right.
Or if they deliver the information right, because sometimes they not.
Well, exactly. So when in doubt, if you're in a situation where you can get an interpreter, that's the best case scenario. And so many you can, what is the Google app on your phone, the translator? There's so many different ways to try and translate for them. And one of the things we'll talk about as we do community assessments is, let's say you have, I'm just jumping ahead here, let's say you have a community with a large non-English speaking. You can do flyers, you can do pamphlets in their primary language. I mean, we all get on customer service phone calls, right? Press 1 for English, press 2 for another language, press 3 for another language. But it is a huge vulnerability. Okay, I want you to know epidemiological triangle. We talked about resilience, poverty. Let me just jump back, talk about poverty. Poverty is another vulnerable, people living in poverty is another big vulnerable population. Okay, poverty is the primary cause of vulnerability. Think of remember we could look at our clients in the community as individuals, families, aggregates of the community, groups, the elderly, the children. What kinds of effects do you think an individual, a family, a portion of the community living in poverty, what kind of effects, what kind of risk does that pose? Access to education? Maybe access to healthcare?
Access, not good access to proper foods.
Proper nutrition? Maybe
Yeah.
employment? Maybe resources? You know, let's say you live in an impoverished community that doesn't have a lot of resources to support individuals and families. We talked about veterans being vulnerable. The one thing we have to remember about vulnerable populations is the way we care for them. Showing respect, compassion. They all have a story to tell. Most vulnerable people don't want to be vulnerable, right? They want to be resilient and rise above. So it's up to us as nurses, if you're working in the community, no, we can't make assumptions. We can't be judgmental. We have to let them tell their story. Right? I'm not going to talk about epidemiological triangle now because it's going to come up later, and don't worry about it. So, questions about our introduction to vulnerability. All right, let's talk about, well, here's your list. We've already identified all these. Poor, poverty, homeless, pregnant teens, veterans, migrant workers, immigrants, mentally ill, substance abusers. Part of what makes up a community and what makes up individuals and families in determining the health of individuals, families, communities is called social determinants of health. We use these 5 domains when we do our assessments, whether it's, like I said, individuals, families, full communities. What's the economic stability of the family or the individual or the community? What's education? What's the education access and quality like? Do we have a low graduation rate, high graduation rate, high literacy rate, low literacy rate? This is how we're doing our assessments with community. What about healthcare access? Let's say there's very limited access. There's not a lot of urgent cares or emergency rooms or hospitals in communities. And if there are, let's say they're not great quality. So the quality of care you get may be risky. And so healthcare access is an important determinant of health. Okay, neighborhood. What kind of neighborhood do you live in? Is it a new neighborhood? Is it an old neighborhood? Do you live near a big transportation hub where air pollution might be an issue? Sound may be an issue. Do you live in an agricultural, rural community? Which brings risks in itself. Is your neighborhood high? Does it have a high crime rate? Gang violence? Or is it a safe neighborhood? And then social and community. That means resources. What kind of community is it? Does it have a lot of resources? Does it have religious places you can go and practice your religion? Does it have rec centers where you can go get exercise? Does it have parks? Does it have walking paths? Is it clean? Is it dirty? Does the trash get picked up? So all these things play into how we determine the health of individuals and the health of families and the health of communities. And those 5 domains we look at. And it will look different in every community. Okay? School nurse. We talked actually a lot about school nursing within the quiz. All right, and this is just a quick slide to show you that school nurses, and I can attest to this, play many roles. When I went to school years ago, school nurses, you went to the school nurse for a hug or a Band-Aid. That's it, right? Now, school nurses are performing direct care. I can tell you, in my experience, just retiring a couple of years, I was doing trach care, replacing trachs, catheterizations on girls and boys, insulin pumps. I mean, it's all inclusive now, right? Students with physical, mental, behavioral disabilities, all are inclusive in school. So I did a lot of direct caregiving. Okay, we're always educators, health educators. We're educating the students, the staff, the administration, the parents. Consultant, we're working with physicians. Consulting with physicians. Oh, we have a kid that was just diagnosed with asthma. You know, what's going to be the protocol for school? So a lot of communication with medical people. Case manager, right? That means we work with the most medically fragile, complex kids, right? Maybe we're case managing. You'll learn later, but case management really, if you're a case manager, you're coordinating care. You're the coordinator. So with the high needs kids in the schools, we're helping to manage PT, OT, speech, clinic visits. And then school nurse also does a lot of community outreach, health fairs, immunization clinics, reaching out for speakers. I used to have people come in from the local mental health center to come in and talk to the high schoolers about risks of mental health issues. All right, so the school nurse, my point is, the school nurse is an extremely important role in the healthcare team for kids. Okay, let's put our primary, secondary, tertiary to work here. Okay, primary prevention in schools. We're trying to prevent injuries. So we may be talking about, like I said, seatbelt safety, bike helmet safety, reducing the risk of diseases. So we're teaching everybody, all the little kids, how to wash their hands. Secondary, screening for risk, early identification. So some schools do scoliosis screenings. We do vision and hearing screenings, maybe BMI screenings, maybe obesity screenings, right? We're trying to identify kids at risk, primarily vision and hearing, doing vision and hearing all the way down to the preschoolers, trying to identify any potential vision and hearing issues early so we can get them corrected. And then tertiary, lots of kids with tertiary issues in the schools. Okay, diabetes, asthma, allergies, seizures, cancer, VP shunts, complex chronic illnesses, CP, muscular dystrophy. Okay, so lots of tertiary interventions going on in the school setting as well. You're going to get this in peds, but simply with this slide, just want you to know the different stages of growth and development, how we identify what's the prenatal period, what's infancy, what's early childhood. Don't need to know a lot from this slide. And then this discussion question this week, you were picking 3 common childhood ailments. Okay, all those little snippets of readings in your books this week went through all of these. And plus you're going to get this in peds as well if you already haven't. Okay, so what I want you to take away from each of these, let's say you're presented with a kid with any of these, okay, any of slide 6 or slide 7. Here's what I want you to take away. What is it? How's the kid gonna maybe present? What kind of signs and symptoms would you be looking at? We had a couple of quiz questions about that. What would be the treatment? So I'm trying to get you to think about, yes, it's fine to know what ADHD is, but how do we manage it with a kid? Right? So what would be some suggestions? Maybe sit closer to the front of the classroom. Do they take medications? Making sure they get to the clinic, take their medications. Maybe giving them small breaks. Don't punish them if they act up. Don't punish them with making them lose recess. So I'm trying to make you think of in a clinical setting or a school setting, how would you manage this kid? How would you manage a kid with iron deficiency anemia? How would you manage a kid with scoliosis? Because that's how the quizzes and HESIs and exams are going, right? Taking your knowledge and applying it to clinical judgment. So think of yourself as a school nurse when you're thinking about all these. How would you care for a kid with asthma? Well, we got to make sure if it's not under control, they have an inhaler in the building. If they have an allergy, do they need an EpiPen? So how would you manage them in the clinical setting? And that clinical setting can be a school clinic. So that's how I want you to look at common childhood ailments. Okay, we don't really have a definition for family anymore, right? Family is whatever they say it is, right? Families are non-traditional. There is really no traditional definition of a family, right? There's 5 functions. Let me get to the, hey, there's 5 functions of a family. Well, here there are 2, 4, 8 functions of a family. Okay, physical. So so this is where we talk about functional family, dysfunctional family. This is how we define families, functionality. It looks different in every family, but these are the basic ones. Does the family provide essentials for life? Is there a roof over their head? Can they pay the bills? Do they provide an atmosphere of health and safety? Do they provide love and care and guidance? Do they interact with each other appropriately? Or do they ignore each other and fight and scream and yell? Do families teach each other about values, good morals, good values? Do they have fun together? Do they bond? Do they spend time together? Do they help care for each other? You can answer, yeah, think of your own family. 3 of these, maybe yes, 5, maybe no. All maybe yes, all maybe no. But think of yourself out there as the public health nurse, community nurse, and doing a family assessment. This is how we look at how a family functions. Whether we classify them as a good functioning family or a dysfunctional family. And get them whatever resources they need. Make sense? Family health risks. They come in 3 ways: genetic, environmental, behavioral. Okay, we're all born with, I'm almost done. I know we're at 5:30 and I want to be, because we haven't taken a break. So this is our last slide. All right, so genetics. We may be born with certain predispositions. Maybe we have a long family history of cancer, heart disease, stroke, alcoholism, substance abuse, iron deficiency anemia, whatever. All right, so we may be predisposed to certain things. Okay, that's part of it. Environmental. Okay, let's go back and think of the environmental risks for our family. Physical environment. We already talked about this. What kind of town do you live in? High crime, low crime, great education, poor education, great healthcare, poor healthcare. Living near rivers and streams that might be polluted, living near transportation sites that might cause air pollution. Okay, maybe there's discrimination based on ethnicity or your immigration status. Okay, is there religion that you can practice freely? Is it a community in poverty? All those are environmental factors. And then the last is behavioral. These are your choices. Behavioral, your risk is your behavior. Do you eat healthy, unhealthy? Do you exercise? Are you obese? Do you have a lot of chronic diseases? Do you not seek out primary care to care for yourself? Okay. So the risks to everybody, individual, family, community, can be genetic, environmental, behavioral. Okay. So that's your week 1 and week 2 summary of content. I know I did a lot during the quizzes, but I want to cover what I didn't cover in the quizzes. Does that help?
Thank you for the in-depth explaining. It definitely did help. Thank you.
All right, good. You have a Kahoots for weeks 1 and 2. I encourage you to do it. Okay, it's just a refresher. It's not mandatory, but it's a good refresher. Okay, next week we have a quiz next week. Quiz 2's next week. It's only going to cover week 3. Week 3 readings. Okay, and then I'll send you with my announcement this weekend. We're going to do a case study, a simple case study next week, and I'll break you guys out into groups. Nothing you need to prepare for. You just read through the case study. Your groups are going to answer a few questions just to reinforce the content from next week.
So
Okay.
you said, sorry.
Go ahead.
So you said for week 3, you recommend that we do the Kahoots
For this week, you have a Kahoots for weeks 1 and 2. So I just recommend you do it now. as a review for weeks 1 and 2. I don't have a Kahoots for week 3. We're gonna do a case study in week 3.
So how can we start studying for the quiz though, for week 3? Is it just we
You have
just
all your
need the
readings.
information?
Yeah, you have all your
Okay.
readings.
Okay, module.
Okay.
Yeah. Actually, I think week 3 is all Canvas readings.
Yes.
Yeah, it's all Canvas read. There's no book reading next week. It's all in your module. And actually, it's really good reading. So read your module readings and you should be fine for quiz 3.
Yeah, I wasn't good for 1 because I did your announcement slides for week 2, but I didn't see them in week 1. So now you're going through all that. I didn't see it. I must have missed it, but that was helpful. So now I'll keep looking out for it. Thank you.
Right.
You're welcome.
Thank you.
Okay, I am gonna stop my recording.